A safety group at the CDC now says it's likely that COVID vaccines from Moderna and Pfizer are linked to rare cases of heart inflammation in adolescents. Here to answer your questions is Dr. Daniel Koritzkis, Chief of Infectious Diseases at Brigham and Women's Hospital. Good to see you.
Good to see you, Emily.
So this condition is called myocarditis. Most of these cases have been mild, but it still sounds scary. What can you tell us about the risk?
Sure. So there have been a little more than 600 cases of myocarditis and more than 133 million vaccines administered in this age group. That relates to a rate of about 13 per million overall. It's important to note that all of these cases have been mild. Everybody has recovered. There have been no deaths.
What can you tell us about the symptoms? And you said there that people have recovered. These are mild cases. Is there any long-term impact that we know of?
Well, that's a great question. So the symptoms are typically those of inflammation around the heart. So discomfort in the chest, shortness of breath, sometimes palpitations. We don't know for sure yet if there are any long-term consequences, but most of the time when people recover from myocarditis, they'll be just fine.
All right. Are you concerned at all, though, that people will see this headline about heart inflammation and think, you know what, I'd rather just take my chances with the virus?
Well, that's certainly a concern, and it's important to keep this information in context. So we know that there have been 2,800 deaths in young people from COVID since the beginning of the epidemic, more than 300 in the last several months, and more than 4,000 cases of the multi-system inflammatory syndrome. If you put that in context, and this was done by the CDC people who were speaking today at the meeting reviewing the risks, you would prevent far more cases of COVID and COVID hospitalization and of COVID ICU hospitalization than you would see cases of myocarditis in this 12 to 39-year-old group.
This perspective is so important. Before you go, I want to ask you about the Delta variant. Is the health risk from that variant different from the risks from the original strain? Is it causing more severe symptoms in younger people who aren't vaccinated?
It's certainly spreading more, and we do think that it is causing more severe disease than the original variant and even more severe disease than what is now called the Alpha variant, what we used to call the UK variant. And it's important to note that the group in which virus is spreading most rapidly is now this younger group, and that's why it's so important for them to get vaccinated to stop the spread, to protect their own health as well as the health of those around them.
Exactly. All right, Dr. Koritzkis, thank you so much for your time and your insight. We appreciate it.
Always happy to help.